All right, I thought I would show you something kind of cool, which is kind of a newer way to study. So, this is an application which is free for now called ChatGPT, openAI. So, this is a language learning model. This is software that is capable of it doesn't understand what you type, but it can interpret what you type and come up with the result, which is usually pretty good. So I'm going to ask it to help me generate some exam questions to help me study. So I'm going to pick a topic, let's say renal physiology. So a series, a once I select an answer, tell me if I'm right or wrong, and then display the next item. And so this can interpret to um, some degree our our input and give us a um, reasonable output. Okay, so now it wants me to read this and then give it an answer, and then it should tell me if I'm right or wrong or why. So let's read the vignette it generated. The 35-year-old man with a history of uncontrolled diabetes mellitus presents to the emergency department with severe fatigue and shortness of breath. He reports that he has not been able to urinate for the past 2 days. On physical examination, he's found to have edema and jugular venous distension. Lab values, BUN. Um, okay, so let's guess at this. Um, because this is not giving us the normal values, which we should ask it for. So let's see. Mm, let's just say he has AKI. Okay, so that's pretty good. It gives us a reasonable exam item. I'm going to ask it now to start including normal lab values as well. So that's kind of cool, right? It doesn't really understand what you're asking it, but it can kind of help you to study by giving you some practice questions, basically. Uh, so this technology is relatively new. This came out a few weeks ago. It's free for now. Eventually, they'll probably start charging. Um, but I could see this being a really helpful way to study because these are the kinds of questions you might see on your COMLEX. 60-year-old woman with a history of hypertension and type 2 diabetes mellitus presents to the clinic with complaints of fatigue and muscle cramps. She reports that she has been experiencing increased thirst and has to urinate frequently, especially at night. On physical examination, she's found to have dry mucous membranes and increased skin turgor. So she is dehydrated, um, muscle cramps, and she has increased thirst, um, elevated creatinine, um, sodium is at the top of the normal range, potassium within the normal range, osmolarity is elevated, urine concentration is normal. Let's say E. Now, these won't write exam questions as well as the examiners for COMLEX will, but it'll give you a start, give you an idea. And if you're having trouble finding exam questions to practice with, why not use this, right? So what's it say? Correct. The patient's symptoms of increased thirst and frequent urination, along with low urine-specific gravity and normal serum sodium and osmolarity levels, suggest that the patient has diabetes insipidus. Condition is characterized by production of large amounts of dilute urine due to deficiency of the hormone vasopressin. See, that's something I don't like. It should say antidiuretic hormone, which helps regulate water balance in the body. The increased thirst and frequent urination are the body's attempts to compensate for the water loss. The patient's serum creatinine and potassium levels are within normal range, which is not consistent with other renal disorders such as acute tubular necrosis, nephrotic syndrome, or acute kidney injury. Okay, I'm in reasonable enough. So this is not perfect and it can make mistakes. And if it makes a mistake, there's no one to hold it accountable. So what you're going to have to do is double check what it tells you. So if you look up sources, so don't just believe this because this is not a human being. This is a computer generating stuff. But yeah, that's the general idea. This is a good way to practice, and you can pick any topic that you wanted to generate exam questions for, pretty much the same way, and it'll do that for you, and that's really cool. New way to study. Dr. Berman out.